Hello, it's Dr. Pat, and we have two baby bunnies with us today, 3 weeks old. Take a look. So these little guys, while perfectly adorable little miniatures, have very big problems, and today we're going to be discussing what those problems are. So they were part of a, how would I describe it? It's like a farm petting zoo scenario that they were born at, and the veterinarian responsible for that facility noticed that these guys had a problem, and one of the techs took these babies in an attempt to rescue them. And if you look at the little gray baby, you'll see, I'm going to lift gently, that we're not using this back leg at all. So when we walk, come here, little one. We were just holding it out to the side, not bearing any weight on it. So the concern is that we've broken that leg or dislocated that hip. Both very serious in this little tiny baby. They give kisses too. You're not going to give kisses now? No kisses. So the concern is that we have a fracture of this leg, so we need radiographs to see exactly what's gone wrong here and what we can do about it. Surgery is a delicate option for these guys. They have little tiny bones. They're not fully ossified yet, and so things like amputation are a consideration. We have had other rabbits that had fractures that the owners weren't able to repair, and so we have had to do amputations in the past. One of our techs took in a three-legged bunny. They do great. We just protect the other foot and leg and make sure that they don't have pressure sores, but they can lead a normal life. So it's worth trying. The other big deal with both of these babies is if you look at their eyes, and their noses, they have respiratory disease. So the eyes are crusted shut, there's nasal discharge, they have full-on upper respiratory infection. And this may be a part of the primary problem, or it could just be opportunistic due to stress. So babies that are stressed are already immunosuppressed because they're babies, and then other infections can come on board and start wreaking havoc. And so we're concerned about that with these little ones as well. So we're dealing with a couple big problems, but there's a third one. So the other thing when you look at them, I'm going to turn our little white guy around, is if you look closely at the skin, and we'll try to show you this, they have crusts all over their skin, throughout all the skin and the coat. And you can see some of the buildup here. And when they're just relaxing, they're actually scratching constantly. And so they also have a mite infection. And again, those are probably opportunistic. It may be a reflection of care in part, but really all of the stress is a reflection of that care. So these guys were fortunate because they did find someone who recognized the distress they were in and is willing to try for them. So send your TLC to these little babies. They need it. We're going to do what we can to get them back in the mend, but it's iffy for them right now. The prognosis is guarded. But again, they're babies. Babies sometimes are more resilient than older animals, and we're going to try. Thank you.